here for another episode of our Rational Wellness Podcast. It's confusing to know what you're supposed to do to be healthy. What should we be eating? How should we be exercising? Should we be avoiding red meat, cheese, and butter? Should we be putting butter in our coffee? How should we be exercising? Should we be taking calcium supplements, or are calcium supplements harmful? Should we take fish oil? Is fish oil harmful? My goal is to bring clarity to some of these issues using the top scientific research and interviewing experts in the field who can help us understand some of these issues. Please subscribe to the Rational Wellness Podcast on iTunes, Stitcher, or YouTube. So let's get started on your road to better health.
The hope was so enticing back in the days.
Hey, Rational Wellness Podcasters. Thank you for joining me again today. And our topic for today is thyroid, and we're going to discuss hypothyroidism, which essentially means that we will be discussing Hashimoto's autoimmune hypothyroid disease, since over 90% of the cases of hypothyroidism in the U.S. are autoimmune in origin. In developing countries, a nutritional deficiency, a lack of iodine, is the most common cause. To provide you with a little background on the history of thyroid disease in the United States, hypothyroidism for many years was basically due to a lack of iodine, and this was known as goiter, and this would lead to the enlargement of the thyroid gland as the thyroid struggles to produce enough thyroid hormone without one of the necessary building blocks, iodine. And this was common in the US, especially across the upper Midwest and the Great Lakes region, which was known as the goiter belt. But then we started on a nationwide iodine supplement program where iodine was added to salt and goiter rates were eradicated and rates of Hashimoto's skyrocketed. The same can be seen in other countries around the world that have engaged in public health measures to supplement iodine, such as Turkey, Greece, and Brazil. And several studies have shown that restricting iodine has brought a reduction of autoimmune thyroid. So iodine is now very controversial. Some claim that taking large amounts will help hypothyroid problems. Small amounts are contained in many natural thyroid supplements, and others recommend avoiding iodine for those with Hashimoto's autoimmune thyroid. So this is just one of many controversies surrounding hypothyroidism, which is why I've asked our special guest, Dr. Holly Lucille, to help shed some light on this very important topic of the thyroid. Dr. Holly Lucille is a naturopathic doctor and also a registered nurse, and she's a nationally recognized educator, natural products consultant, and TV and radio host. She's also the author of several books, including Creating and Maintaining Balance, A Woman's Guide to Safe Natural Hormone Health, and The Healing Power of Trauma Comfrey. An acclaimed expert in the field of integrative medicine, Dr. Lucille lectures around the U.S. and has appeared on national TV programs, including Dr. Oz and The Doctors, among others. She's regularly quoted in both consumer and peer-reviewed journals and was listed in Time Magazine's Alt List as one of the top 100 most influential people. In 2012, she launched her own talk show, Myth-Defying with Dr. Holly, and she's now the host of the podcast Mindful Medicine on Radio MD and iTunes. Dr. Lucille is in private practice in Los Angeles, and her practice is presently part of the Body Well with our friends Dr. Michael Carragher and Dr. Jill Stocker. Dr. Lucille, thank you so much for joining me today on the Rational Wellness Podcast.
Thank you so much for having me.
That's great. So the first topic, the first question I want to ask you is, when you see a patient in your office, what's the first thing that might alert you to the fact that they may be suffering with hypothyroidism or sluggish thyroid? You know, what types of symptoms and appearance are you looking at?
Yeah, so think about it. You know, at the end of the day, when we're talking about thyroid function, that active thyroid hormone, T3, getting into each and every cell in our body is really responsible for both aerobic and anaerobic metabolism. So you think about signs of hypometabolism. I mean, every day I see people walking
So,
in.
by the way, for the layperson, that means slow metabolism.
Yeah, so an under-functioning metabolism, so protracted fatigue, constipation, hair that's been thinning, stubborn weight gain, depression, and sometimes the list goes on and on. So you think of just your metabolism, even digestion slowing down, anything just slowing down. That I start to think that the thyroid might be involved.
Great. So if we suspected thyroid and we wanted to test for it, what would be the best test to run to measure thyroid health?
Yeah, this is a great question because I think it's also one of the bigger controversies out there,
Yes.
quite honestly, because it is alarming and frankly unacceptable to me. The number of folks that are not properly cared for and paid attention to that come in with their lab tests in hand and their practitioners that they've been seeing say, oh, you're normal, your thyroid is fine. Meanwhile, their health and their quality of life continues to suffer. You know, I think the number one thing that we should be looking for when it comes to suspecting, because I'll ask you this, or I'll remind people this, you know, why do we run lab tests in the first place? It's truly not to diagnose. It's always to confirm what we're suspecting clinically. So having that good clinical acumen, taking that intake, listening to the patient, understanding the contributing factors by getting the history. And that's number one. So number two, I like to run far more lab tests than the conventional medical doctor might with just the TSH. I like to make sure that, because there's, you know, when we're looking at the thyroid function, there are so many things going on. I look at thyroid function overall as sort of like a relay race. There's many different places throughout this entire intricate system where we can drop the baton. So let's just take this real quick. I would say leg number one. So if you're looking at a 440, right? So they start running, that would be the higher brain centers working, right? The hypothalamus and pituitary that are getting signals from every single cell in our body like, hey, I got enough thyroid, or hey, could you give more? So that is leg one. There can be some things that happen there. Leg two would be that communication down to the thyroid itself. All right, so that would be leg two. And then leg three, we would have the making of thyroid hormone directly at the thyroid level itself. T4 mostly, then we've got to convert that right into T3, active T3. That would be leg four, and actually getting that into each and every cell in our bodies. And there's so many places where thyroid function can be disrupted. And so it's important. So I like to run a total T4. I like to run a free T4. I like to run a free T3 as well. And then because, as you said, 90% of people with underfunctioning thyroid, it's really due to an autoimmune destruction or Hashimotos. So we're always going to want to run antibodies, the thyroid peroxidase antibodies, the thyroglobulin antibodies as well. And I also, in our modern day, you know, T4 is converted to reverse T3, which is inactive, and it's there for a reason. It helps us with, it would be like driving a car without any brakes, right? It's part of our stress response, and then also T3 itself. So I like to run reverse T3 so I can see an entire picture. With those full labs, I can make sure I understand, is there a conversion issue that's happening? Is there a binding? Sometimes I'll do thyroid binding globulins because I think that the thyroid is being bound up and not free to the tissue for it to do its job. So very, very, very comprehensive panel when we're suspecting underfunctioning thyroid.
So just to play devil's advocate here, if I'm a health insurance company or I'm a conventional MD, look, T3 and T4 correlate with TSH, so why do you need to run all these other tests?
Yeah, actually I've seen it not, especially if somebody is having an autoimmune, an active autoimmune process, they don't necessarily correlate. And if you're binding up the thyroid hormone, or if there's a conversion issue, I would argue that those values really are able to give us more insight as to how to treat. Because if you're going to fix the problems of an underfunctioning thyroid, we need to understand where those problems are. And with TSH, I would say it's unpredictable with age, infection, stress, certainly, calorie restriction, inflammation. And the other thing with TSH is that the range, that's another big controversy, I would say.
Yes.
And it is like, what range is acceptable? I think that
They used to say up to 4 was normal.
Yeah.
Then it was 3.5. Now we've settled on 2.5.
Exactly. The National Academy for Clinical Biochemistry has recommended since 2002 that TSH be between 0.5 and 2.0 and consider that the optimal therapeutic range. And that's usually, I like to see TSH under 2 because there's been many studies suggesting that a TSH above 2.5, they're associated with metabolic syndrome, insulin resistance, fasting triglycerides, elevated fasting triglycerides, I should say, increase in blood pressure, and body mass index as well. And so TSH, it's a great test to detect a pituitary tumor, I would tell you that much. But for thyroid disorder, we just need to get a little bit more in depth.
I'm going to play devil's advocate, if you don't mind, one more time.
Sure.
Why do we need to do these autoimmune tests since there's nothing you can do about autoimmune diseases anyway?
That's a great question
put the patient
as well.
Thyroid,
You're
right?
a great devil, I'll tell you. And I had this conversation with a very esteemed endocrinologist, asking him really, I'm like, hey, if autoimmune destruction is really one of the primary causes of underfunctioning thyroid, why don't you run these antibodies? And he said to me, and I really respected it, it's because our treatment would not change.
Right.
And so, that's the thing. I believe that there's value in all systems of medicine. And conventional Western reductionistic medicine has its place. Everything has its place. But the problem is in their scope, if your TSH is elevated, meaning the pituitary is shouting at the thyroid, wanting more hormone because the body is asking for it, what they're going to do, even if it's an autoimmune condition in origin, is they're going to give Synthroid, the medication, which is pretty much straight T4, and get your TSH within normal limits, and that's your treatment. My plea would be that if this is an autoimmune destruction, and if we don't treat the autoimmune condition, that the patient continues to suffer symptomatically, clinically, and also that autoimmune condition can continue on to affect other organs. I've seen this happen in young women who have not had their Hashimotos treated correctly, and they've gone into premature menopause because their ovary was the next gland that I believe got involved in that autoimmune condition.
Right. So essentially what you're saying is when we have an autoimmune condition, we have the immune system attacking the cells and organs of our body,
Yes.
leading to progressive destruction. And once the body starts in that attack mode, it could potentially, in fact, we know statistically there's an increased risk that there'll be damage to other organs. And if all we do is treat the thyroid with thyroid hormone, we haven't addressed the autoimmune condition.
That's correct. And that's where I see people suffer. Even though their TSH might be within normal limits, they continue to suffer symptomatically, and their quality of life just continues to tank. And so it's a really big problem.
Right. And I think this brings up a key reason why it would be beneficial for most patients to not only see their conventional doctor for diagnosis and some of the treatment, but to also see a functional medicine doctor like yourself or myself to explore the underlying causes, because we have some strategies to try to find the cause of autoimmune diseases and some strategies to try to help reverse those. So can you talk about what are some of the underlying causes of autoimmune thyroid, Hashimoto's thyroiditis?
Yeah, you're right. As a naturopathic doctor, I've always been taught to identify and treat the cause, to think things through. And I also agree with you that I encourage people to get second opinions by going to somebody like you, by going to somebody like me, who have tools in our toolbox that we can take up these variety of contributing factors and truly get to the root cause so we can treat that. from the inside out, and people can truly get their health back. And so when you think about autoimmune conditions, I mean, dietary factors, stress, environmental insults like heavy metals, there are many different things that can spur on a autoimmune condition. You know, we think about immune system, where does it mostly lie? It's in our gut. A lot of times too, what's been interesting in the last couple of years is two questions that I've...
By the way, most people might not be aware of the fact that 80% of our immune system is located all around our digestive tract.
Yeah, I mean, it's amazing. And so when you think about that, you know, I know that I used to have a saying in school. We used to have a saying in school called heal the hole. And it's the hole that starts here and the hole that ends back there, because so much of our overall health has to do with our ability to take in nutrients, digest, absorb, assimilate them. And then knowing too, that is where our immune system, we have to go to the gut. It's so important. It really is. And so that is one of the biggest things from a treatment perspective that we look at when Hashimoto's is involved.
So what are some of the things you'll look at in terms of the gut that might relate to thyroid problems?
So certainly dietary factors. Gluten, the number one recommendation that I make when we've confirmed that there is an autoimmune disruption going on and it's contributing to underfunctioning thyroid, is 100% gluten-free for sure. And then what we want to do...
Why is that?
So because gluten can be extremely provocative, you know, I know that it's another big controversy for the most part as far as, is this just a fad, this gluten-free? But quite honestly, what happened is that back in the 60s, they started using something called dwarf wheat. Dwarf wheat was used as genetically modified to increase the yield of the crops. It also increased that glue in the gluten itself, the stickiness, and also it decreased the nutritional value. And it can be very provocative, and also it lead to what we call hyperpermeability, or what most people know as leaky gut. You know, if you look at our intestines, they're one cell thick. It always just amazes me that our intestines, all the way through, one cell thick. And we've got these little tight junctions that allow, after we've assimilated our nutrients, to get them through into our bloodstream so our body can use them as fuel for our biochemistry, so we can do all sorts of things like me raising my hand right now, etc. Right? When our gut gets leaky or it's hyperpermeable, those tight junctions get really, really big, and larger protein molecules get in there. The bloodstream and the immune system goes, hey, what are you doing here? You shouldn't be here. And it starts to mount a response. And wheat can actually contribute, gluten can actually contribute to that sort of leaky gut type of situation. And so I do believe that this is where the immune system can get overactive, sometimes confused, and then it starts to attack our own system.
So essentially what you're saying is if the immune system attacks the gluten in the wheat, gluten is a protein found in wheat, it can get confused, you said, and so then it can start to attack our own thyroid gland. And isn't that because there's a similarity between the proteins in our thyroid and the gluten, right?
There is, yep, absolutely. And that's where this all starts to happen. And it's absolutely fascinating. But this is where, if you get down and identify and treat the cause, you know, even though the thyroid is right here, people have asked me all the time in my practice, hey, why are we spending so much time digestively and making sure we're removing any antigens like gluten or anything else? There are dysbiosis, meaning if there's an overgrowth of bacteria because they've had an opportunity to grow and proliferate. If there's an overgrowth of fungus like candida or non-candida yeast molecules, that's important to remove. And then we want to repair the gut. You know, and I was going to say, two of the questions that lately I've been asking in the last couple of years that I added to my intake form for folks is, you know, do you know if you were born as a vaginal birth, a recipient of a vaginal birth, or a C-section? That's one of them. And two, were you breastfed? Because I think about all that we're learning about our entire microbiome, and this certainly has to do with our immune system. And there has been some studies and stated in the literature that, you know, our first pass through for our microbiome to get inoculated with these good, healthy bacteria, right? Probiotics for life, is through our mother's vaginal canal. And sometimes if you are born from a C-section, you don't get that. You get other bacteria. Yes, because people are touching you and there's somewhat of a sterile environment. And your immune system doesn't start to develop as it should. And so that's one thing that I always ask. And then, of course, with mother's milk being one of the best things that we can do to start inoculating our good immune system, it's another question. So those two questions have been really important.
So these are the kinds of questions that you'll get when you see a functional medicine doctor, and this is the way you get to the possible root causes or triggers for some of these conditions. What about other foods? What about foods that are called goitrogens, like broccoli?
Yeah, I've had many discussions with patients, and from what I've seen in the literature and certainly in my practice, you're going to have social issues before you have thyroid issues by the amount that you actually need to eat to have it start disrupting the thyroid. Because I think sometimes I look at it, if you steam some of these foods that are labeled as goitrogens, that can decrease the activity of those goitrogens. And so a lot of times that's what I'll recommend, because we want to have people eating plant strong, nutrient dense diet, especially when we're dealing with thyroid, because it's one of the most nutrient dependent sort of functions in our entire body. But there are some things, that when I'm trying to work in settling these antibodies down, I will pull out all the stops. We will look at foods across the board, environmental assaults, environmental heavy metals, wondering what we can clear out, what can we help reduce exposure to, so we can get those antibodies down. And that's another level that we want to be looking at. The TSH is one thing. First of all, how is the patient feeling? That's the number one thing. Two, the TSH is another thing to understand, because usually these folks who have been diagnosed with an autoimmune condition, because their thyroid has started to be destroyed, they are going to be most likely dependent on some thyroid replacement therapy. So we want to make sure that we monitor that. But I want to see the antibody level come down, because that shows me what we're doing is working, and also that fire, that storm of the destruction, the autoimmune destruction, is starting to calm down.
Great. There's a couple of other common foods that are part of this that are also considered goitrogens, and I'm wondering if you think those are foods we probably ought to take out of that thyroid patients' diets. And one of them is soy, and the other is canola oil.
Yep, soy and canola oil definitely are no-nos when it comes to soy in general. I feel like, because most of it, 99%, is genetically modified, it's sort of like a really creepy crop for me. So that is definitely something I have folks avoid, in canola oil as well.
Okay, so I want to bring up the iodine question that I mentioned at the beginning.
Yeah.
So, should patients consume, extra iodine? Iodine's often included in thyroid nutritional supplements. It's often included in multivitamins. There are some practitioners who recommend high dosages of iodine. It's very common, but since most people in the country are still eating quite a bit of iodized salt, is this a good idea?
I have to say, I've been blown away by this discussion, and my peers also kind of having, very educated opinions and different opinions on this subject. So what I've done in my practice is this goes to a case-by-case basis, and I'll tell you what I've noticed. Now, for the folks out there that don't know, iodine is really important for thyroid function. It's actually one of the building blocks of thyroid hormone itself. The T in T4, T3, and there's T1 and T2, but we don't bother much with them. But the T stands for tyrosine, and then the I stands for, or the 3 is 3 iodine molecules, and the 4 is 4 iodine molecules. So it's the number of iodine molecules. So you definitely need iodine. And if you have an iodine deficiency, you're going to have a hard time making thyroid hormone at the thyroid level itself. But it's true. Iodine can spur on a Hashimoto's attack. And also, if you have active Hashimoto's, sometimes too much iodine can actually increase that attack, or increase the autoimmune condition. this is what I've noticed, and this is what I've done in my practice. I will sometimes test for iodine deficiency using a urine spot test, just to get all of the data for my edification in treating the whole person and making sure that I know everything that's going on. What I've noticed is that if I can get the gut under control, if we together, my patient and I, can eliminate antigens, food sensitivities, heal the gut, and then supply antioxidant support. If enough antioxidant support is on board, and we're talking about plant-based antioxidants like high dose, absorbable curcumin, and also vitamin C for sure, then I can start adding iodine, and we don't seem to have a problem. So I add iodine, I make sure I keep track of those antibodies, and I've successfully been able to sort of recover a potential iodine deficiency in a patient and not have that autoimmune condition be spurred on. So that's been my clinical experience.
Okay. What do you think about chemicals in the periodic table that are in the same line with iodine, known as halides? And these include chloride, fluoride, bromide. These can compete with iodine, and many of us are ingesting these on a regular basis. If most of our water has chlorine added to kill germs. A lot of us have water that also has fluoride added. Bromine is added is an additive to many foods, including almond milk and lots of other things. So what are these something to be concerned about?
Absolutely. So especially if there's an iodine deficiency, these other elements that you're right, they're right there on the periodic table with iodine, they're halides, and they can actually then affect our thyroid and attach to our thyroid. And so that's definitely something that we want to avoid. We want to avoid these things. And I think sometimes, and I've seen this over and over again, like in the last 6 years, the rates of thyroid cancer have increased. And so protecting the thyroid is definitely making sure that you have enough iodine on board, because then it's shored up and you don't have to have that competition with these other things. But if you are left vulnerable because of a deficiency, and it's true, we once were mostly iodized, like over iodized, and it created a problem. But iodine deficiency, I think, is sort of on the rise again, and it's more prevalent than most people would assume. And that's why I think it's important to test if this whole thyroid picture is coming into focus, and increase the antioxidant and increase that iodine supplementation so we can protect the thyroid against these halides that are definitely dangerous and can spur on cancer.
Right. So among the antioxidant supplements, can you talk about the importance of selenium as an antioxidant, which helps with thyroid?
Absolutely. And this is really important too. Selenium is probably the most important nutrient for thyroid function. I mean, there's other zinc for sure, but the thyroid is selenium dependent. And if you look at the compromised soil that we have, it's selenium deficient. Also, if you have accumulation of heavy metals, cadmium, mercury, both are known to bind up selenium. And then, so without selenium, our thyroid cannot function. It cannot do that conversion. And so I think it's extremely important, and that's that from T4 to T3, that active thyroid hormone that in each and every cell provides that aerobic and anaerobic metabolism. And so selenium, and honestly, I know that dosing here is sometimes controversial, but I'll start somebody out on 800 micrograms of selenium, especially if there's active Hashimotos, to get those antibodies down, and we'll taper off from there.
Interesting. Yeah. I was rereading Isabella Wentz's Hashimoto's Thyroiditis, which I think is probably the best book I've ever read on thyroid, again, for the third time. She was talking about how you end up with hydrogen peroxide being created as part of the conversion of iodide to iodine, the usable form, and that this hydrogen peroxide will end up damaging the thyroid cells unless you have enough selenium to help neutralize that.
Yeah, and that's why I think that I've been so successful in increasing somebody's antioxidant status first before going in and recovering that iodine level.
What are some other nutrients that are helpful for thyroid?
I always test vitamin D because optimal vitamin D is really important for optimal thyroid function. I always like to see ferritin.
What's your preferred range for optimal vitamin D?
I would say anywhere between 60 and 90. I like to see.
On the higher end. Okay.
on the higher end for sure. And then ferritin, I like to at least get to 90 to 110. So if that's low, I'll
For
do.
those who don't know, ferritin is basically a measure of iron in the body.
Yeah, and stored iron. And so I'll do some bisglycinate form of iron as well as vitamin C for absorption, just to recover that. I think that's very important. Zinc is very important. Magnesium, extremely important for the thyroid. It's one of the most nutrient dependent thyroid, essential fatty acids, actually. It is the thyroid function across the board, one of the most nutrient dependent functions we have in our body.
Excellent. So when it comes to those patients who do end up requiring thyroid medication, what do you find is the most effective form of thyroid medication for most of your treatments? You know, apart from nutrients and supplements and things like that.
Sure. So if somebody is requiring thyroid replacement therapy, and a lot of times I'll get people that come into my practice and they're already on Synthroid, and if they're feeling okay, and this might not be their clinical presenting issue, but if they're on Synthroid and they're feeling okay, and Synthroid is straight T4, so you do have to rely on the body to convert that over to T3, and you know, if there is a conversion issue, this sometimes can be a problem. I noticed this first with my sister who was on Synthroid, but I know in her lifestyle, a couple things that will disrupt conversion. Nutrient deficiencies for sure. We're looking also at heavy metals. We're also looking at alcohol use. We're also looking at sleep disturbances. And so I could go down sort of the list and just check them off for her. And so I was encouraging her to switch over to a more porcine derivative of thyroid therapy, where you're going to get a T4, but you're also going to get a little bit of that straight T3. So you don't have to convert that. And a lot of times people do really well on, they say natural, it's natural for pigs, but that is the other alternative. And so I do this case by case for folks. Sometimes I know there's two schools of thoughts as far as the autoimmune condition. Sometimes folks do better on Synthroid, because the porcine derivative can perhaps attract that autoimmune, that condition, or the antibodies. That's one thing, but also it can act as a deterrent almost, or as sort of like a kind of like, hey, look over here, you know. And so I usually start for myself. If somebody has been newly diagnosed by me, we'll definitely do a more natural derivative of a thyroid replacement therapy. And we make sure that we don't do super physiological doses, because, you know, one of the things that can help stop endogenous production of thyroid itself is certainly higher doses of thyroid replacement therapy. I mean, one of three things, or all three things, happen sometimes when high doses of thyroid are given. First of all, you can stimulate the binding globulins, because the brain is pretty smart and is like, yeah, I think that's a little bit too much than I've ever had in my entire life. And so it'll bind up, it will stop that endogenous production at the thyroid level itself, and or receptor sites will start to get less sensitive to that thyroid hormone. And I'm dealing with a gentleman right now in my practice who has been on a tremendous amount, I've never seen this before in my life, of thyroid, TSH almost undetectable. And there's been binding changes because of that. So we have to work really slowly to bring them back.
Of the natural forms, which particular brand do you like the best? Armor, WP Throid, Nature Throid?
The WP Throid, I believe that if people are really sensitive, I use that quite a bit, because we're looking at no additives. We're looking at it being really clean and clear, and that's really my go-to.
Oh, okay. Recently, I talked to a doctor who was telling me that because Armor got purchased by another company, that the formulation has changed and it doesn't seem to be as effective.
Well, I think they got purchased by the makers of Synthroid, and
oh, really?
they're also increasing the price quite a bit.
Oh,
and so yeah,
we've seen that story before.
Yeah, and that's why I think some folks are going over to Nature Throid or WP Thyroid because of that.
I know sometimes these different products have additional ingredients like you were talking about the NP-throid. I know Synthroid has certain additional ingredients that sometimes people can react to.
Yep, and that's why case by case, and you always, I think that's the most important thing. You always have to be looking at what's going on. As you said, broccoli, soy, a lot of people think those are healthy foods, but when we can't get the antibodies down and somebody is not progressing as we think they should, these are where you just have to get the sleuth hat on and make sure that we're looking at everything, including if they could be reacting to something in their medication. And sometimes that's the case.
Right. So, for example, Synthroid contains cornstarch and lactose.
Yes. And if people are really sensitive, corn is it's a big one for folks. And that could just, if their gut isn't in good shape, then that could be just, continuing to stimulate the antibodies of the immune system that continue then to attack our own body, our own tissue.
Yeah. And these are things that typically don't show up on the ingredients. You have to go to their website to look at it.
Yeah.
Yeah.
Or come see somebody like you or me.
Exactly. So one more topic. There's a condition called subclinical hypothyroidism. And, it's somewhat controversial. Some people say it shouldn't be treated at all. What do you think about this? Maybe you could explain what subclinical hypothyroidism and then let us know if you think it's something that we ought to be treating or not treating.
Yeah. So I think what you're talking about when somebody says subclinical hypothyroidism is somebody presenting with symptoms that we talked about of hypothyroidism, but their TSH is within normal limits. So I've always thought, well, I don't think this is a subclinical condition because what's so subclinical about my clinical symptoms, right? I would look at those symptoms. And then I would say sublaboratory hypothyroidism perhaps would be more accurate, but then once again, this is one of the biggest controversies. And so I absolutely 100% feel like sublaboratory and or subclinical hypothyroidism should be treated. But once again, I think we need to ask, because I do think also, Dr. Weitz, if you go into the endocrinology journals themselves, these thyroid panels have been outdated for some time. So, and we can't treat lab tests, we have to treat people. And so it is a whole picture, but we have to ask, hey, could this be an autoimmune issue? Are there not enough building blocks? Is there a binding problem? Is there a conversion issue? Are we not absorbing the T3 enough into the cell? Is there competition? Sometimes dysbiosis can create end products that can compete at the end of the day for our receptor site, where that T3 is supposed to get in there and be the gas, and be the gas in our moving car, our bodies. Are the receptor sites not responding? There's something called thyroid resistance. It's kind of like insulin resistance. It's not that there's not enough insulin, it's that our receptor sites just got a little bit fatigued around the whole thing. And so the thyroid is just one of those things where I've always said, and it's kind of funny because the way that I practice, and I know the way that you practice, that sometimes medicine isn't rocket science. It's amazing what can happen to the body if we can just allow it to do its job by healing itself, removing food sensitivities, working on different lifestyle things, recovering nutrients to optimal status, all, so that's why I say not rocket science, but I think with the endocrine system, especially the thyroid, the devil really is in the details, and it's like the direct opposite. We really have to get in there and just fine tune and fuss through the entire clinical story and have good clinical acumen so we can really help people get their lives back. Because it's your metabolism. It is your get up and go. And when you're get up and go, get up and went, it doesn't feel very good.
That's great. I think that's a good note to end our discussion on, Dr. Lucille. So for patients and practitioners who'd like to get a hold of you, what's the best way for them to reach you?
My website is pretty straightforward and simple. It's just drhollylucille.com. So HOLLYLUCILLE.com.
That's great. Thank you, Dr. Lucille. I very much appreciate it. And I'll see you in January at our meeting.
That sounds great.
Okay. Thank you.
You're welcome.